And welcome to our In Focus discussion tonight on maternal mental health. Joining us first is Carla Carlson, a mother of 3 who suffer from postpartum mood disorders. And Carla, first off, thank you so much for joining us tonight and being willing to share your story.
Yeah, you're welcome. So happy to be here.
Good, good. We need to get this message out. So you have 3 children.
Yeah.
You just had your 3rd baby. Congratulations to you. Tell us about the birth of the first, though, and the emotions you had afterwards.
Sure. So I had my first baby 4 years ago, and no idea what it was going to be like to have a baby. And had the baby, had a rough birth, was very, very sore, and definitely struggled immediately with anxiety right away. Severe anxiety, lots of crying with no reason behind it. I wasn't eating. I was having intrusive thoughts of hurting myself or my baby. And they were very fleeting, so that would happen, and I would go nurse my baby and just cry and cry and cry because I was terrified that I had had that kind of thought. I was terrified to tell my husband and share with anybody else. But I ended up going to see my doctor, my OB, for a different health issue right after she was born. And they took one look at me and said, you need to come in and see your doctor. And so I came in and saw him and was able to get help right away by just talking to him. And he just listened to me and squeezed me into his schedule, and we talked. And he reminded me how difficult postpartum depression can be, or postpartum anxiety, but also that sleep deprivation can really do a number on you. And so once I was able to talk through that with him, it really helped me just realize this is normal and I'm going to be okay. And so that experience with my daughter only lasted for a couple of weeks. The thoughts started to fade away. I was able to eat again and sleep again just by being able to talk to someone and being told this is normal.
Wow. So tell me, it was like right after the birth you started feeling this
In the hospital. Yeah.
In the hospital even?
Yeah.
Fascinating. Okay, well, after experiencing postpartum depression after baby 1, you thought you knew what to expect after the birth of your 2nd child. And what happened there?
Yeah, so I had my son, and I expected to feel the anxiety again, and I didn't. And so I thought, oh my gosh, I'm in the clear. I've got this. I don't have anything to worry about. And then about 5 months down the road, I started recognizing that I was just kind of losing it on my 2-year-old at the time, and I didn't understand why I was so angry at her for like spilling a cup of milk or whatever it was that she did, or not listening to me. And I was scrolling Instagram one day and saw a post about rage being a sign of postpartum depression. And once I had heard that, I thought, oh my gosh, I think I have postpartum depression right now, and I just didn't realize it. And unfortunately, during that, once I realized that, I did not go get help. And I looking back, I 100% wish I would have, because I wouldn't have had to suffer with that by myself.
That's what's so fascinating is you're right, like they're just such different symptoms, and being a part of like being a tired mom or being angry at points, you just think I don't have as much patience because I have 2 kids now, but really you're right, these are symptoms. And I feel like you're so fortunate because you went into that appointment and they detected it, or you saw that scroll on Instagram that helped you, and so many people out there just aren't getting the help. So tell me then, you didn't get help during that 2nd episode of postpartum, even though you were expecting to have it, mainly because it felt different. So then now what's happening with the 3rd baby you just had?
Yeah, so I actually experienced postpartum or perinatal depression while I was pregnant with my baby. It could have been a lot of the COVID-19, the pandemic and everything going on, and some situational parts, but I very much attribute it to hormones as well during my pregnancy. And so I ended up not getting help when I was pregnant, but I did tell my doctor, hey, I'm having some of these rage symptoms again, I'm feeling kind of low. And so we just kind of had a plan in place. And so I continued my pregnancy okay, felt like I had it under control, and then I had my baby, and the rage kind of started a little bit again, and this obsessive compulsive need to keep my house clean. And I just decided I don't have to do this by myself anymore. I really don't. It's my 3rd baby. I should know better by now, and I can get help. And so I did. I went and saw my doctor, and I'm on just a low dose of medication to help me just for the next few months, and it has been a game changer.
Can we talk about that? Because I think a lot of women, whether it's not severe to severe, think, oh, I think I can handle this. But you're saying you went to your doctor, you were able to get this medication, and you don't have any shame behind taking that medication.
No, and that's what stopped me with the 2nd baby, was shame. I was ashamed of how I was yelling at my child and feeling these angry feelings that weren't me. But it's definitely, shame is a big part of it, but it just needs to be normalized. It's okay to go get help.
It really is. What are your final words? What do you want the audience to hear from you this evening?
I just want you to know that you are not alone. There are so many women out there who are struggling, and you don't have to suffer alone. You are loved, and you are important, and you are seen.
And coming from a person who has felt a wide variety of feelings after postpartum and even during pregnancy, I think that that is a powerful message from you. Carla Carlson, thank you so much for joining us here and for sharing your story. We really appreciate it.
Thanks.
And thank you for staying with us for our second In Focus discussion tonight on maternal mental health. Joining us now is Amy Rose White, a perinatal psychotherapist and founder of Postpartum Support International Utah. Thank you for joining us in studio tonight, Amy.
Oh, you're so welcome. Thanks for having me.
So we've kind of touched on this for the last several minutes, but what are some of the symptoms of postpartum depression and anxiety and mood disorders?
Well, one of the problems is we think of postpartum depression as crying all the time and kind of curled up under blankets in a ball, and most times anxiety, agitation, insomnia, anger, rage, and irritability, as Carla was saying, are actually more common symptoms of perinatal pregnancy or postpartum anxiety and depression. So oftentimes people don't really understand that they have postpartum depression at all.
No, not at all. So talk to us, because this is your field. What kind of treatment options are out there for women who may be looking at this thinking, yes, yes, yes?
Well, fortunately, there's a lot. Free support groups abound. Postpartum Support International and the local Utah Maternal Mental Health website has a list of tons of those. There's specially trained psychotherapists on those lists as well, your healthcare provider, but it's really important to remember that medication and even psychotherapy aren't the only options. And the sooner people reach out for support when they're starting to realize they don't feel like themselves, the easier it is to treat less invasively. So medication saves lives. It helps so many people. And it's one reason that some women are afraid to talk to their doctor, because they think that might be the only tool that they're given. But the reality is there are supplements, there are nutritional and self-care strategies, like really focusing on that sleep deprivation and getting social support, that can also go a really long way to treating these symptoms.
So tell us too, what kind of, I know you touched on this, but the support for women, what do women need? What kind of support systems do they need?
Well, they really need to know that they're not alone. And I think in this COVID environment, obviously the deck is really stacked against families, unfortunately, right now. Hopefully that's going to be improving towards the summer. But they really need family support. They need help with sleep. Sometimes they need a night nurse. They need a doula during pregnancy and childbirth to really be there for a woman's or birthing person's emotional well-being. They need to know that there are other women that get it. And sometimes as a new mom, you go to a group or even an online Zoom meeting, and new moms seem to be, they're at yoga or they're at Mommy Me group, and,
right.
and all the moms seem happy and together. And so the person who is suffering is going to feel really out of place. That's why a specialized postpartum support group, even online, and we have so many now because of COVID, really helps break that stigma and make people feel more comfortable, like they're not alone, they don't need to be ashamed, and it really is safe to ask for help.
So Amy, there are so many women here in Utah. The number 1 in nearly 2 women deal with this. Can you give me your take on why? I mean, any idea why? I know there's not any clear study, or maybe there is.
Well, we are the state with the highest childbirth rate in the nation, so I think that has something to do with it. I also believe that Utah has a little bit of a culture of perfectionism. A lot of the famous mommy bloggers, and no offense to them, they're very fun to follow, come from Utah. There's a lot of imaging from our culture in Utah about what it means to look like the perfect mom or perfect parent, and I don't think that does us a lot of favors as new parents just trying to struggle and survive those early weeks and months.
That's such a good insight. As society, in regards to our awareness of this issue, how do you think we're doing, and how do you think we are responding to it?
Well, better. I'll say better. In the 15 years that I've been working in this field, the CDC, the NIH, the ACOG, which is obstetric organizations, the American Academy of Pediatrics, everyone is finally on board that this is a public health crisis and we need to do something about it. So I would actually say I'm really pleased as a nation where we're moving with maternal mental health, and with Utah in particular. PSI Utah has done some fabulous legislative work to move our state forward in terms of universal screening, education, and treatment for all families.
And we're going to go into that more in just the next segment as well. But can I just ask, Amy, again, because this is your expertise, when a woman calls for help, what can she expect? What's going to be on the other side of that call so it's not so daunting?
Well, the most important thing is to make the call to the right person. And the sad thing is some folks will go to a care provider or even a therapist that doesn't have the right training. So use that database that Brooke talked about, use that database to find a trained provider. And when they reach out to a trained provider, they should immediately hear they're not alone, that person knows what they're going through, and they're going to make a plan. They're not going to go into childhood traumas or things from the past. That can come later if that's necessary or part of therapy or their primary care. But what they need is a plan of what they're going to do to get better now. And when you hear that, then you know you're in good hands. And the most important thing is, if you don't feel like you're heard, if you don't feel like you're believed or taken seriously, or you don't feel comfortable with the plan being suggested to you, keep reaching out. Ask a family member to keep reaching out for you. Have friends get involved. Don't give up until you find a fit that really resonates with you.
And that is hard. That could be long and daunting, but you're right, it's worth it. Your final thoughts. We only have about 30 seconds left, but I want people to hear the most important message you want them to hear tonight.
Well, I really want people to know that this affects the entire family, including partners of any gender and fathers. At least 10% of dads also experience postpartum depression. And there is help. You are not alone, and do not muscle through it. There's a lot of tough moms out there who are used to getting through difficult situations. And this is one where it's actually in your children's best interest. Their development will be better. They will be healthier adults if you are well. So healthy mom, happy family.
Yes, indeed. My goodness. Thank you so much, Amy Rose White, founder of Postpartum Support International Utah. Thank you so much for joining us here tonight.
You're welcome. Thank you.
And welcome to our third and final In Focus discussion tonight on maternal mental health. Joining us now is Brooke Dorff, maternal mental health specialist from the Utah Department of Health. And Brooke, thank you for joining us tonight.
Thank you.
We know we saw you in the story just minutes ago. You pretty much summarized what was going on in Utah, but tell us the numbers, paint the picture here for us.
So like you said, it's almost 1 in 2, it's 43% of Utah moms are experiencing depression or anxiety during pregnancy or postpartum, which is a lot of people. So we have about 43%, and then we see that, you know, this is what is affecting our death rates here in the state. Suicide is our second leading cause of death in Utah. So, I mean, this is a lot of people, and it's affecting a lot of different systems, family systems.
And you said in the story that one of the most important things Utah can focus on would be maternal mental health. Why is that?
I think Amy Rose did a really good job of highlighting that it affects the entire family. It affects the children, their development, their growth. It affects moms, you know, partners, communities. When a mom's mental health isn't right, then she can't take care of her child in the way that she wants to, which is, you know, doing all the things that moms do. I mean, there's so much unpaid work that moms do, and if they are struggling and suffering, then they can't do all that in the best way possible.
Most definitely. That is motivation to hear just that. Amy touched on some of the resources out there, but you yourself have been working hard on compiling the resources that are out there now, and so many more resources than there were just even 5 years ago from Emily Dyche's story. Tell us what people can find when they turn to the right place.
Yeah, so if you just go to maternalmentalhealth.utah.gov, that's that map that we talked about. One thing I want to point out is that you can search for support groups on there, and most of our support groups here in Utah are free. A lot of people will benefit just from going to one support group. So it can be free, it can be cost effective, it can be done at home online. It doesn't have to be hard or expensive. So that's something that's really important. But Instagram is a great resource too. We have Maternal Mental Health Utah. There are a lot of different places, but find someone you trust to talk to, and that's the first step, really.
I think one of the other barriers, right, is people are probably thinking, how do I pay for this? Like, we're just getting by now. My mental health is just going to have to wait because I don't have the money to do so. This is encouraging to hear that there are some free resources, and your website highlights how you can get help through insurance, right?
Exactly, yeah. So you can actually search by no insurance if you want to see what's free out there and find all the different things. We've worked really hard also in the state to train specialists at the local mental health authorities, and they're in every single county, and they take people who have no insurance or are underinsured. So we have a lot of people that are there and willing and able to help.
Oh, that's such encouraging news. Talk about the legislation, things that can improve. What needs to happen there?
Well, and that's one of the things that we are working on based on legislation is training more people, training more providers on maternal mental health. It's so important that, you know, people don't have long wait times, that they can afford it. We are also working, and this isn't necessarily legislation, but it's just a societal thing, is stigma, making sure that we know we can talk about maternal mental health, that moms know that asking for help doesn't make them a bad mom, and making sure that we're, you know, busting down all the stigma barriers that exist here.
I think one thing too that we haven't even touched on that I always find fascinating is some of these risk factors, Brooke, that things that make us more likely to have to deal with postpartum issues. Can you talk about a few of those risk factors?
Yeah, we actually just published a study in January 2021, but one of our biggest risk factors in Utah is moms under the age of 24. So if you're a young mom, if you're a mom of multiples or had a NICU stay, any type of complication, chronic illness during your pregnancy or postpartum, which as I start to list them, a lot of moms say, oh, that's me, oh, that's me. Another thing is a significant life event, so moving or loss or gain of job, a pandemic can be a risk factor, going through something really intense.
I'm happy to bring this up because I think, like you've said, women at home thinking, that's me, and those are the risk factors I've dealt with, so maybe I really can identify with this and not just think I have to white knuckle through motherhood.
Exactly.
Tell me a bit about what you feel like the society can do to improve, help the situation for maternal mental health.
I think it's important just to talk about it, tell your story, and it's kind of scary to do that, and it's hard to find a place where you feel safe to do that. But we can talk about it. We can also make sure that we highlight that this is more than just hormones, right? Because if we talk about that specific thing, then we know moms up to 1 year can experience this long after their hormones are slightly regulated. We can break stigma about who can get, you know, depression. This can be, you're still postpartum if you've had a miscarriage, if you've had infertility issues, if you're an adoptive parent. So there's a lot of different things that we can do to make sure we include a lot of people who might think, oh, do I fit? Is this something I'm going through?
Most definitely. Such an important message, Brooke. Thank you for all that you do and for pushing the awareness in this issue. I think earlier when we did an interview, you just spoke so much about having compassion for yourself and, again, getting help. With help, things do get better. Brooke Dorff, maternal mental health specialist for the Utah Department of Health, thank you for spending your time with us.
Thanks.